Have you ever experienced frequent abdominal pain and bloating, followed by alternating bouts of diarrhea and constipation? If so, you might be dealing with something known as Irritable Bowel Syndrome, or IBS for short. IBS is a common disorder that affects the large intestine, the final section of your digestive tract, where most of the water and electrolytes are absorbed from food. Unlike other intestinal disorders, IBS is chronic, meaning it lasts a long time, often years. It's not something that goes away after a week of rest and a good diet. But here's some reassuring news. IBS doesn't cause changes in bowel tissue, nor does it increase your risk of colorectal cancer, a common concern when dealing with bowel-related issues. It's a pesky, persistent condition, but not one that should cause you to fear for your long-term health. So, if you have been experiencing these symptoms, you might be dealing with IBS. You may wonder, what causes IBS and how would I know if I have it? Well, while the exact cause of irritable bowel syndrome isn't fully understood, several factors seem to play a role. One of these is the nervous system. Abnormalities in the nerves in your gut can cause discomfort when your abdomen stretches from gas or stool. Poorly coordinated signals between the brain and the intestines can make your body overreact to changes that are normal digestive processes, leading to pain, diarrhea, or constipation. Inflammation in the intestines is another potential cause. Some people with IBS have an increased number of immune system cells in their intestines. This immune response is associated with pain and diarrhea. Severe infection, often from bacteria or a virus, can also trigger IBS. On top of this, changes in gut bacteria, or microbiota, can influence IBS. Our guts have about 100 trillion bacteria, some beneficial and some harmful. Changes in the proportion of these bacteria may trigger IBS symptoms. Now, how would you know if you have IBS? The signs and symptoms vary, but the most common include abdominal pain or cramping, bloating, gas, and alternating bouts of diarrhea and constipation. Some people also experience mucus in the stool. Remember, the exact cause of IBS isn't known. Factors that appear to play a role include muscle contractions in the intestine, abnormalities in the nerves of the gut, inflammation in the intestines, and severe infection. Now that we understand the symptoms, what can we do about it? Well, the good news is there are several ways to manage irritable bowel syndrome, or IBS. The first step is often diet and lifestyle changes. This might mean eating smaller meals throughout the day, increasing your fiber intake, or staying hydrated. Regular exercise also plays a crucial role in managing IBS. Then, there's medication. Several types can help, depending on your symptoms. These might include antispasmodics for cramping, laxatives for constipation, or antidiarrheal agents for loose stools. Lastly, don't underestimate the power of the mind-body connection. Psychological therapy can be incredibly useful, especially cognitive behavioral therapy, which helps change the thought patterns that can exacerbate symptoms. While IBS is indeed a chronic condition, it doesn't have to rule your life. With the right treatment plan, you can effectively manage your symptoms and lead a healthy, fulfilling life. Remember, it's important to talk to your healthcare provider about your symptoms and treatment options. Let's recap what we've learned today. Irritable bowel syndrome, or IBS, is a common disorder affecting the large intestine. Its symptoms range from cramping and bloating to more severe cases of diarrhea or constipation. The exact cause remains elusive, but stress and diet can play a role. Treatments are available to manage symptoms and improve quality of life. Thanks for watching. If you found this video helpful, don't forget to subscribe and hit the bell for more informative videos like this one.